Welcome to the office. Welcome to the office, Miguel. How can I help you? What brings you to the office?
I've been having instability, dizziness, or kind of first week 2 years ago I've been in. I just woke up like dizzy, and then after that.
Hold on. 2 years ago, you woke up dizzy. You weren't partying the night before?
Actually, it's funny. I was partying before.
Okay.
I just woke up like that.
Dizzy, and you've had party before. This is the first time you were woke up?
I've been partied before.
But it's the first time you were dizzy.
Yes.
Okay, and can you describe it? What does that mean? You sat up, you were dizzy. You were laying in bed, opened your eyes, and you were dizzy.
It was like, I wouldn't say vertigo, but it feels like I'm swaying sideways as I'm walking.
Okay, but when you woke up, you were laying down, you felt it, or when you came up, you felt it? Like in bed, lying on your back or side, you felt it, or you stood up, or you sat up and you felt it?
Oh no, I felt it as I was standing still.
Laying down.
Yes.
So you woke up feeling it laying down.
Like vertigo.
Okay, that's what I want to know. Okay, so it feels like the room is spinning.
Yeah, but it lowered down afterwards. Like the first week, I wasn't able to walk at all. I felt like I was falling. After that.
Falling to the right. Sorry, I'm going to add the very specific.
That's fine.
Falling to the right, falling to the left.
To the left.
To the left. Okay. All right, and then you had that for about a week.
Yes.
Okay. Did you do anything? Did you see anybody? You went to the hospital?
That was during I believe the beginning of the pandemic, so it was kind of hard to see a doctor. So I waited.
Okay. Did you see anyone since?
Yeah, I saw a doctor, a couple chiropractics. I went to go get a MRI.
Okay.
And
anything in the brain? They did
nothing came out.
Nothing came out. Brain is clear.
Yeah,
no tumors.
Just a small cyst, but that's.
Where is the cyst?
Like somewhere around the brain. I forgot. Like that.
Inside the skull or in the spine?
I think inside the skull. I'm not sure.
Inside.
Yeah.
They did a brain MRI.
Yeah, but they told me it wasn't nothing,
Nothing to worry about.
Yeah, exactly.
Okay, fair enough. Okay. So you've been dealing with this for 2 years. Have you had any relief, or you're still going through it?
No, I'm still going through it.
Okay. Was there any relief with anything you did? Have you been able to manage it?
I took physical therapy, lower a little bit at times, but I feel like I'm just stopping the symptoms, not the cause.
Got it. You've been watching, haven't you? You're getting it. Good. Okay. All right. So MRI ruled out nothing.
Nothing.
There was a slight cyst on the right side, left side.
Right side.
Right side. But you feel like you're on the left, falling to the left. Okay. Not a problem. Okay. What else? That's your number one complaint.
The dizziness, yes.
Dizziness, vertigo, feel like I'm falling to the left side.
Yeah, and beginning of this year, I started feeling pain, probably because I started working from home, so that's just stiff on
pain where?
On my neck, by my back, like L5, down there.
Okay. All right.
And feel numbness and tingliness actually in my toes at times, like this.
Both toes, left side more, right side more?
Index toe. Like, not this one, sorry.
The second toe?
Yeah, second toe.
Second toe, okay. Is your second toe bigger than your first toe? Is it longer?
This one, yeah.
It's longer, yeah? Both of them?
Yeah.
Okay. You're working from home right now?
Yes.
Okay. This numbness and tingling started when?
Beginning of this year.
Because you've been sitting more, your posture's been off, I'm assuming.
Yeah,
you're not as active as you were.
Uh-huh.
So pandemic time became more important for us to be more active and mindful of our posture. A lot of us are sitting on a chair or a table, on a computer, sitting like this all day on a mouse. Are you on a mouse or trackpad?
Desktop mouse.
Mouse, okay, that's good. All right. Okay, what else?
That's pretty much it.
Okay, that's a good start. And if I see anything along the way, I'll let you know. Okay. So we have the vertigo and dizziness. That's number 1. Number 2 is the numbness and tingling. Correct. Number 3, you put down digestion also.
Oh yes.
Tell me about your digestion.
So I drink a lot of water, but the same way at the beginning of this year, I felt like there's pain around my stomach area when I put pressure.
On the left side or both sides?
Literally on the left side of my belly button.
Left side of your belly button. You feel it right now?
Yeah.
Okay. So it's a good test for us later to see if you still feel it. Okay?
Okay.
All right. So we'll start with that. And if anything comes up along the way, please let me know. I'm going to go over your x-rays first. I want to explain we do have our full spines. We have the paper ones today. And I'd like to go over that first. Again, any questions along the way, please stop me and ask. Okay? If you're uncomfortable with anything I'm doing, just tell me to stop. Okay? Let's go over your x-rays and let me explain what I see. Come on over, please. Okay. So, Miguel, this is a picture in time. It tells me how you've evolved from birth. 24 bones in the spine, 23 discs in between, and this is the foundation of the building. In order to have a stable structure here, we need to have a level base and foundation, right? Now, you're telling me vertigo, dizziness, it can be upper cervical related up top here. It can be related to digestion. Now, let's say it is up here. I call this the penthouse. But if the basement isn't level and stable, nothing we do up top in the penthouse holds. Does that make sense?
Yes.
Yeah. So let's first evaluate this, and there's some things. It doesn't look so bad, so there's something hiding in here we got to figure out today. Okay? Let's look at the numbers of the foundation. Okay? We have 59, 59, so there's no rotation of the sacrum as such. 216 and 217 is a 1 millimeter difference on the left, means it goes up 1 millimeter. And there's no rotation of the pelvis this way, these line up. So that's kind of misleading to us. But something is causing this to have this curvature. And this curvature is starting the process of instability. Okay? Now, if I look at your L5 here on your side, you got a beautiful level L5 disc. L4 is tilting, but that's part of this curvature. And then we got some calcium built up here. Okay? Means it's been there for a while. Okay. So where might this be coming from? I circled that one right there. When we look at the tailbone, it should be a smooth arc. We got a nub here, we got a nub here. That's first sign to me that there was a tailbone injury. Second sign to me is here. I'm going to erase this now so we can see the SI joints a little bit better. This is whitening in here, but this has calcium. We're losing the joint line there. Is binding, and it looks like it's binding on both sides. So you got a lot of that stiffness. You don't have smooth movement of those hips, I'm assuming. Yes?
Yeah.
Yeah. Okay. Now, it's the good news, as I said, it's not rotated this way or this way. We don't have a lot of rotation this way or this way. So, where is it coming from? I circled it here. There's a bend in one of those falls in your tailbone. Okay? And let's erase this now so you can see. It does this. It comes down and it bends, kinks this way. And this kink is contributing to this. Okay? Does that make sense?
Yes.
Okay. Now, let's go over level foundation principle. This is the level base starting at the sacrum. First one to go off level is L5. But we're not doing L5 until we have a stable base. Okay? L5 goes off, 4 goes with it, 3, 2, 1, 12 comes back. 12 lines up with the base. Next one to go off is T10. 9 goes with it, 8, 7, 6, all the way back to 5. Next one to go off is 4. And 4 takes the whole head over to the right side. So the majors on the x-ray, this is an x-ray, still got to find it on you. 4T, 10T or thoracic, 5th lumbar, S3, S4. Those are the majors I'm finding there. Now, when we get to the upper cervical, what happens? What? Sorry?
Oh no, it's straight.
It's curving, right? So what is the body trying to do? It's going to want to bring it up on one side to level the head. So we have compensation happening in the upper cervical. If it's been there a long time, long-standing compensations can become subluxations or nerve pressures. Okay? Now, we'll decide if there's something up there. But what I want you to really see, you're local, right? So it's a little easier to work with you. I want you to really see foundation, sacrum down here. And this area, T4, is what's causing this neck to deviate to that right side. And if you're on the mouse all day like this, the posture and habit is contributing to it. Does that make sense?
Yes.
Questions so far on this x-ray?
No.
Okay, let's talk about this one. Discs are good. I'm happy with your discs. They're fine. Discs are good. Discs are good. Discs are good. This one, this is a compensation, but I think it's part of your activities growing up, okay? But here's what I want you to see in your posture. We're designed to have 60-degree curves. I would like to see maybe a tiny bit more curve in your low back, number one. Number two, I want you to see this. So 5 looks good. 4 is tilting, 3 is tilting, 2 is tilting, 1. It's a stair-stepping effect, we call it. And if I want to be really, 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 I can say maybe it's a 0.5 millimeter back, L5, maybe. But there is a stair-stepping effect, right? Compensation, start down here, compensation. These muscles and ligaments get longer, these get shorter, so you feel tight on that right side. And then you're sitting like this on the computer, okay? I would suggest getting a learning stool, a gym ball, or a can-do disc for your sitting positions. We have to change those habits, okay?
Sounds good.
All right, let's continue. You with me so far?
Yes.
Now let's talk about that upper back shoulder stiffness and tightness you get after a period of time because you're sitting, right? Now, I do your posture assessment, L5, we ran the laser level. It should go through 7 and 2. Yours is here. So there's an anterior forward head carriage. Modest angle is about 12 to 15 degrees. The research shows for every 1 degree forward, it's like 10 pounds of extra pressure on the lower cervical spine. So 12 to 15, we're feeling 120 to 150 pounds. So you're sitting period of time, everything feels heavy after a while. Does that make sense?
Yeah.
Okay. Questions on this so far?
No. It's...
Now digestion. So digestion-wise, here's what's a little misleading, and here's the good news too. Your Megan Blasi, your air bubble is decent. Maybe it could be a little bigger, but it's good. I'm okay with that. But you have all this stuff here, right? This is all undigested food. Ascending, transverse, descending. All of this is telling me you're not absorbing and assimilating your foods as effectively as you can. You're young enough. You can make these lifestyle changes now. I'll give you an anti-inflammatory grocery list to work on for about a month. Okay. Neurological control can be in here. If it's part of a compensatory mechanism, we're not chasing the symptom, are we? No, we have to go to the cause. This area relates to your adrenals, it relates to your energy, it relates to light sensitivities. Do you have sunglasses? You have to wear sunglasses a lot, or you're good on that?
No.
You're good on sun. Perfect, okay. Energy-wise, you wake up in the morning, are you the person who gets up and goes, or it takes you half an hour, 45 minutes to get going?
No, I get up right away.
You get up and go. Okay. And again, you're working from home. You're on a computer 6, 8, 10 hours a day.
Yes.
I'm assuming. We're going to talk about some modifications. Okay. Do you understand the x-ray?
Yes.
Okay. Have a seat over here, please. Starting at the base of the neck. C3. C3, left side, 6 points. Good. It looked like it was going to break, but there's a lot of tension in his body even just standing there. Just pulling him this way. You can see how he's tilting, and this muscle's just pulling him.
That's where I actually feel numbness too.
That's where you feel it, right?
Yeah.
You can see it. All right, so it's misleading here. He's got cord pressure. Cord pressure normally comes from C1. He's got classic cord pressure actually coming from C3, maybe C2. Interesting. That's a new chapter in the book. So the needle, the meter, have you heard me talk about cord pressure?
No, I haven't.
Okay, so the meter is sticking left side all the way down left side. I got to deal with this first, then I'll have you walk, then I'll recheck everything.
All right. So
Okay? So it's a little different case. If you go back to some of the vids, I do talk about cord pressure. Head down, please. Good. Beautiful day in LA, guys. Okay. That's C2. I'm pushing a little firm. It's moving. It may be tender, yeah, when I'm touching it, but it's moving. Head down. I got it. C3 is the hardest bone in the body to adjust and evaluate. That's 2.
Oh, that's where it hurts.
That's the one. You feel that?
Yeah.
Bend left, bend right. You pop your neck a lot too, don't you?
Yeah. Is that bad?
Self-cracker?
Is that bad?
It's very bad.
Oh.
Look, if you do this and it does it, it's fine. It's just ligaments popping. You're taking it past the paraphysiological zone and you're popping it this way and this way. You're making it hypermobile. And making it hypermobile later on, what does the body want to do? Stabilize. How does it do it? Calcium. Okay? Even the knuckles, we talk about it. This, no bueno. This is okay. Pull them, gap them. This is fine. Okay? You get anxiety, dude? You get some shortness of breath?
Not really.
No shortness, right? No. Okay. All right, let's do 3. Left hand up. Let's put a seatbelt on. And back. Are you? Let's do this. All right. C3. You okay with that?
Yeah.
Good. 2, 3. Gotta hook it underneath. Well, breathe in. There you go. Gotcha. Walk it off, please. Nice clunk specific. Walk it off, taking a nice deep breath, please. Good. One more time. Back over here and have a seat, please. Let's continue. Now, from what I just did there, take a nice deep breath in while you're sitting. And out. Good. No dizziness right now, though, right? Yes?
Yeah. Still dizziness.
Okay. Lay down on your, not worse.
Not a little bit, really.
No, is it worse?
No,
is it
it's
more?
not. No.
Okay. So do this just as a quick test. Go to lay down on your right side. Just lay down.
Like this?
Yep. Put your feet up. Okay. Sit up fast. More, less, or the same dizziness?
The same.
Same. Okay. I'm just testing out something. Go left side down. Lay on your left side, both legs up. Sit up straight. Sit up fast. More or less? Same.
The same.
Same. Okay. Okay. Let's see if anybody knows why I did that. It's my version of a very specific test. So check it out now. His upper is clear. All clear. That cleared the upper back too. Come on, dude. All right. And we're down in the tailbone. S3, S4. Can't justify it if there's no pressure. Sir, that cleared all this. Now it's just the sacrum, okay? You ready for me?
Yeah.
Let's do it. Let's go face down. So we're going to do S3. And we're going to do it with a counter or a clockwise torque. I'm going to show you where I'm at. I have your permission, sir?
Yeah.
Good. This is L5, S1. S1 is tender. S2, tender.
Yeah.
S3. That's the one right there. And you can feel there's scar tissue there from that injury. All right. Let's get your foundation right, sir. And we want to do a clockwise torque, we said. It's already wanting to go. That's a piece. Gotcha. Awesome. You okay?
I'm good.
Give it a second. Step off the table. You're good. Walk it out. Walk it out 2-3 times right now. More dizzy?
Less.
Keep walking. Walk one more time. Back over here and have a seat. I guess this is a better eval. Now, not more dizziness right now.
No.
A little bit less.
Yes, a little bit less.
Lay down on the left side. Feet up. Sit up fast. Was that a little bit easier
Yes.
in terms of the dizziness?
Yeah.
Right side down, please. Lay down. Sit up fast. This is the foundation, guys. A little easier now to sit too, I see. Good. Awesome. Let's see what shifted and if something else shows up. You good with me, Miguel, so far? We're good. That's where we're going to start. That's where we're going to start. All clear, brother. Let's test it. I want you to feel it now, okay? Sit up straighter. Okay, L5, come all the way back into extension. Good? Again, L5. You remember S1?
Yes.
Better? S2.
Yeah.
This is the one we adjusted. Good?
Yes.
Okay, can I continue? I do want to work on your feet today.
Sure.
I do want to work on your ears today. Ears, there's, people ask about this ear adjustment. There are 3 bones in the ear. The incus, the malleus, and the stapes, and there's this fluid in the semicircular canal. So that ear adjustment that I give actually helps reset the bones in the semicircular canal. There's a very specific way. It's not me just yanking, someone just yanking on the ear. Go on your back first, please. Let's check your ankles. Tender.
Ow.
Tender.
Not as much.
Not as bad. This is the ankle you sprained. I don't want to pull the ankle today because of the S3 on you. I will use the board. We'll do the talus, fibula, and the heel. First, talus, fibula. Turn to your left side, please. Good. Heel, calcaneus, PL. There you go. Sit up for me and turn. Good. How was the dizziness? getting up fast?
A little subsided.
Little subside. Okay. Now, right now, activities. You're walking, playing sports. What are you doing right now? Gym.
Workout from home.
Workout
A
from
little
home.
bit last week.
So you've heard me talk a lot. I want you to be doing 12 to 15,000 steps a day. No weights. You can do some body weight if you want. Okay. I'd rather you not though, if you can avoid it. Just walk, water, and ice for the next 2 weeks. This 10 is probably going to show up soon. Okay. Alrighty. I'm going to work on your shoulders next, okay? Let's get the full tune up. Elbow. There. Over, around. Ears. Good. Walk it off one more time, and then I want to do the buff and polish. We got to buff it out, okay?
Okay.
Scar tissue in the sacrum. That little node we're feeling down low. Keep walking, please. Sorry. As you're walking, tell me if anything is different in your walk even from when you came in.
Less tension and lighter.
Less tension and lighter?
Yeah.
And it's okay if something else hurts, you know?
Yeah.
It's okay. Have a seat over here. Now the buff. So we're doing vibration therapy. The purpose of vibration therapy is to break up scar tissue.
Oh, right there, it feels a little bit.
That's making you dizzy?
A little bit tired, yeah.
A little bit?
A little bit.
Dizzy.
Yeah.
Here.
Let me go a little higher. Right there, yeah.
How about on this side?
Same.
You still feel it?
Yeah.
Head down, please. If I put your head down and do it, same or more?
Same.
Meaning it's more dizzy?
No, it's
less when your head is down.
Yeah.
We're getting an answer, by the way. This way is okay?
Yeah, that was okay.
Now look straight. Sit up straight. Bring your belly button in and up. Hold it there and breathe. Dizzy now? Posture. These are your bad habits, sir. Mina, stand up and look. Sure. So, when your head was down versus up, remember I was telling you about this forward head posture? So when you're sitting, you're like this. And all I did is I changed your mechanics. And now this is part of your homework. Practice when you're sitting, belly button in and up. When you're driving, sitting at home, working. I am going to recommend a learning stool, please. Learning stool or yoga ball.
Okay.
Either or. If you want to get a yoga ball, it's actually better right now because there's other things I'm going to have you do with it. Okay, come sit on this learning stool you can see. Come, check it out. Sit. Adjust it accordingly, please. Adjust the bottom so your feet are on the ground. Yeah, just pull it up. Down a little more. Okay. Sit up straight. Belly button in and up. Okay, this is your posture, okay? Now, if I bring the table down. Yeah. See how it feels on the table. Just put your hands on the table, see how it feels. And the idea is this, it's going to keep you upright, sit up straight, just like that. Okay, and you're always engaging your core. You're not going to let it go and slouch because you have to work on this in order for this to get better and your dizziness will get better. Okay, sir?
Yes.
Okay, come back over here, please. Understand?
Yes.
Questions and anything I found or did today?
No.
Okay.
Oh, right there kind of hurts when you.
This is all the tense muscle because of your anterior head. Go on your back. I want to test out one more thing for you. On your back. Boca arriba. I just want to test your clavicle. And I'm just going to bring this down. The SC joint. Tender.
Oh. Not as much, but
the SC joint is off. I'll set your SC. Can I have you, let's loosen up the back, please. Again, let me loosen up the back. Okay. You can see this one is higher, this one is lower, okay? I'm going to set the SC joint nice and light. I don't know if I've actually shown this yet. Maybe I've shown it once, I think. Maybe. Okay. SC joint, we're going to be right over here. Pisiform contact. I'm going to go through the motion first. And the motion is this. This way. You okay with that?
yes.
That's it. Sit up for me, please. Turn. And there's a little muscle underneath that clavicle. It's called the subclavius muscle. And it gets tight from our posture. So we're going to get in and just loosen it up a little bit for you to your tolerance, okay? You okay with that? Sit up straight, belly button in and up. You'll know his homework to give him an add-in diaphragm breathing. 5, 4, 3, 2. 5, 4, 3, 2. All right, taking a couple of nice deep breaths, please. It's a little easier, yeah?
Yeah.
Yeah. Lay down on your left side. I'm just testing the basic tests I'm doing. Left side down. Sit up fast. Less than before even?
Yes.
Yes. Right side down. Legs up. Sit up straight. Less than before.
Yes.
Stand up over here, please. Squeeze the hand. Squeeze. You sweating on me. You still nervous? Come on.
I just sweat a lot, I promise you.
You sweat a lot?
Yeah.
Squeeze. Hands are good. We need to talk about that later too. That's all parasympathetic.
My feet too, is it normal if my feet cold and sweat or my hands too?
Mm-mm. You have blood work?
Yes, I came out good. So it's nothing.
Okay, good. Well, we're working on the nervous system. Let's see how we do over the next couple of visits. Okay? And you're going to tell me every visit what's different. All right. We have a little bit more here. Breathe in and receive. Breathe in. Straighten out the elbow. Straight. Good. Squeeze. Squeeze. Questions.
Can I wear a neck brace for my adjustment? Like
Last thing you want to do is wear a neck
like
brace.
you seen those on?
What neck brace? Collars?
No. Oh, sorry. A back adjuster, like those little.
At the moment, I'm not a fan of those. Okay.
You know which ones I'm talking about.
I know what you're talking about. I need you walking.
Okay.
And I need you to engage and be mindful of your core. Okay? You start depending on that thing, you become dependent on it. I would rather you get one of those. And it's going to hurt to slouch. That's more important, please. Please. Okay? You're here. I would rather you work on it yourself. If you were older, there was a lot of scar tissue, a lot of arthritis, maybe I'd say, okay, you're too young for that. Okay?
Okay.
Any other questions?
No, that's it.
Welcome to the office.
Thank you so much.
You're welcome.